last one.
Are you ready?
Yes,
Last but not
okay.
least.
Okay. Good morning, everybody. The first one, I would like to introduce myself. My name is Sakari Norasan. I come from Boromarashani College of Nursing, Khon-Kaen, the northeast of Thailand. Actually, I'm a nursing instructor, but also I'm a student at Language Center, University of Otago. Today, I'm proud to represent my literature topic. This one, case management systems for improvement nursing quality. Alright, in shortly, I will talk about the introduction and background, and then the meanings of case manager and the paradigm shift of case manager. And next, the benefit of case manager, and then the role of case managers. And the last one, in terms of conclusion. Alright, at the beginning, case manager start at the United States. Alright, the principle of case manager was established and in United States by the President of Case Management Society of America in 1955. And also, the expecting outcome of case management is improvement health quality. According to this diagram that shows about the illustrate the paradigm shift of case management, we can see that there are comprised of many factors, but mentions on the curriculum of healthcare that's based on client and patients center. This is the meaning of humanized healthcare. I will talk later about the steps of case manager. So I move to the meaning of case management. The various of people defined the meaning of case management. The first one is the Case Management Society of America. Define the case management is collaborative process of assessment, planning, facilitation, care, coordination, evaluation, and advocacy of option and service. But someone define the meanings is the processing guideline to use for improving healthcare, health and health outcomes. Inconsequently, the case management is the collaborative process of assessment and planning and collaboration, implement, monitoring, and evaluation. So that this is the step of, it's like the overall for the process of case management is comprised of 6 steps like I said before. Alright, it seems to similar that something, I think this is the nursing process. It's comprised of 5 steps. It looks like similar the nursing process. This slide show about the process of case management and the process of case nursing process. We can see that we can see that the majorities of process are the same principles, but also case management have more steps. In addition, one good way of doing this is more steps, but also it's quite difficult to use in some time. However, it's clear that the process can improve nursing quality. And this one, the benefits of case manager. I found that the main benefits of case management is clear that the results show about 2 things. The first one is providing high quality, and the next one is cost-effective care. It's like a decrease for cost-effective care. This is important things for findings. This slide shows about the various of studies explore the benefits of case management. Alright, I found that the effective of disease case management in hospital or healthcare service that's significant to study in United States or United Kingdom, and especially in Thailand. That means case management can improve a quality of life as well as decrease the cost of care together. Therefore, there is a best one for a nurse who needs improved healthcare service. And however, there are two components that's relevant of effective outcomes. The first one is the role of case managers, and the next one is the quality request of case managers. All right, the majority of experts agree that nurse as a key success factor will be support the accessibility of healthcare service, and hence nurse must be take a role of case managers. Will needs to the first one is strong problem solving ability that's preferred to the knowledge of nurse, and the next one is aptitudes for teamwork. That means nurse love be a nurse and can to do with any careers. It's like a multidisciplinary. And the next one is investigate skills that's preferred to the practice in the professional nursing. That is important things. And another one is the qualities request for case managers. This is important too. The first one is adequate training and clinical experience. That is relevant to the knowledge in healthcare. And the next one is pedagogical skill. That's referred to high ability of communication or dialogue with multidisciplinary. And the next one is self-affirmation. This is important because of this like love to be a nurse so that she or he can happy when we do the nurse. And the last one is resolution skill. That is important too. It's related to clinical thinking. That is the main point for everyone to need to improve the nursing qualities. And so that the nursing quality significantly involve the professional competencies. But the next one is, on the other hand, the challenges of case manager in the field of points that relates to nursing education and nursing council for developing the high competencies in the curriculum or the short course trainings for case management. Therefore, it should be respond to develop the role of quality of case managers for performance in nursing. All right, in conclusion, case manager or case management is among the changes will enhance to role of nurse. Unfortunately, training should be encourage them to update their skills to the point that they can confidently add some more prestigious duties. This is my results from my review. Thank you for attention. Do you have any questions, suggestion, or sharing? Please.
I have some question for
Yes.
your presentation from your study and review literature. In my opinion,
Yep.
quite overlap between nurse role and doctor role. Could you give an example about case manager for community or hospital in hospital?
Yes, this is a quite good question because of this is the somebody says it's like an overlap from the doctor, but this is the highlight for it's like the main point of view of the someone who established the theory because of the case manager or case management can separate identity of nurse, but not overlap the role of doctor. The doctor just mentioned on care for the patients, but the nurse just mentioned on the care of the patients. And case manager or case management can it's like a top up the identity of nurse. This is the one thing. Like I said before, I try to compare the process of nursing and case management. This is based on the nursing theory or nursing process, but case management can is like occur the career duty of nurse. This is a good one for everyone. And nowadays Thailand is like a boom for case manager in the community or maybe in the hospital. This is the good thing for improve the quality of nurse. And moreover, the doctor just is like a respect the nurse more than before because this is can improve the knowledge, the practice, and the attitudes for to do a duty of nurse, something like that. Yes, thank you for question. And the next one.
Okay.
Yeah.
I think this is a good opportunity for me because I'm not a nurse,
Yes.
and I have learned more about nursing.
Yeah.
Yes, and so that I want to ask you some questions about
Yep.
what would you like to do in your future study of your future.
Thank you so much for in the future.
Yeah.
Not maybe it's relevant my topic, but in my opinions, I would like to study mentioned on the elderly group, but the topic is like a nearly case manager in the elderly who live in the rural area or who live in the city because of different area. But I just mentioned on the structure or the principle of study. This is the important things for starting. It's like a start for the structure and maybe say the contribute the structure for case manager in the Thailand context, especially in the elderly group, maybe different the pediatric or the clinical ward, different context but same principle because I believe this is the process for improved nursing quality in the future. Yes, thank you for question. Do you have any question or sharing? Yes.
Me.
No?
May I ask some question? What kind of ward is appropriate for case management and why?
I found that many data report about the effective of case manager in the clinics such as the diabetes mellitus, and chronic congenital heart disease. Because in my realize, I believe that the chronic disease, this is used for a long time. It's like this, used a long time for take care. That's relevant to the cost of take care. Some of patient is quite high, but if you try to make the case management to take care as a whole, so that as a whole, that means the multidisciplinary work together in the community after discharge from the hospital. Yes, the nurse in the community just take care for the patient. That is the good one for control, or it's like a follow the standards of take care. Because some of problem show about the patient lack of continually to take care, and someone is like not consider about the medicine or medicine, not take a medicine, just give but not take. This is the influence to the government to support the medicine for care or cure the patient. This is one problem. But case manager or multidisciplinary can solve this problem, because the majority of case management is like a quantitative data for the patients. Like that. Yeah. Thank you so much for your question. Yeah. Tukta.
I think that you said case management suitable for chronic illness.
Yes.
May I suggestion
Yeah.
about case management, because if you use case management for every case, I think make more time and use a lot of material and people or something like that. I think case management suitable for complex case like diabetes mellitus, not general case that's complex.
Yeah.
Yeah, you know.
I agree with Tukta, because case management is especially first in the complex case. This is a good one for case management. All right, because it's like a holistic care, like the Tukta topic. That means not mentioned on the physical, that mentioned on the social support or the family member. This is some cases like complex, lack of the opportunity to take care. It's like a death case or something like this. This is a much to mention on, especially on someone. Yes.
I agree for this answer,
Yeah.
because in Ratchavati Hospital is the tertiary care
Yeah.
unit in Thailand. We use a case management in ICU ward, because we have lot of nurse
Yeah.
and like a nurse, one patient, two patient per one nurse.
Yes.
Take as a whole of the patient, like the order, treatment, and evaluation. Yes, I think it's important in ICU case and like a complex case. But in medical ward, cannot use case management, because we have lack of a nurse. Because of one shift, we have about 3 or 4 nurses. And the patient about more than 30 cannot use the case management. It's not appropriate. Yeah.
But I think this is the good point for let's start, because if you like do the routine, you as well as the same.
Yeah.
You not change. But if you consider is the case managers always, so that maybe in the future nurse, especially identity, is like a nurse, not like maybe last or 10 years before, something like this. Yeah, I think this is good view.
Yes, I have sharing you for the topics in the future.
Yeah.
In my opinion, I think for suggest this for specific, and your for topic is so
Worldwide. Because of
not
this is the
specific.
review literature.
Yeah, for the future
Yeah,
for
yeah.
PhD topics.
Yes.
Yes. Okay. Thank you.
Yes, thank you so much.
That's fine. It's fine because there's lots of stuff going on here. But when you were talking, I was thinking about my husband and his situation, because his case was very complex, and there were many times when I thought, we need someone to kind of coordinate, because he would go to one doctor for his broken neck,
Yes.
and then he had neurologists for nerve damage, and then he also had like urology and various other departments.
Yes.
And so sometimes I thought, who is the boss? Who is in charge? Because it seemed to be bitsy and not coordinated. So maybe someone who could, provide some continuity would be very useful in a case like that. On your last slide, you had, unfortunately, training should encourage them to update their skills to the point that they can confidently assume more prestigious duties. So you think that being a case manager would be a better job than being a nurse?